So welcome everybody to this webinar. I'm really happy to see so many faces, not really, but Zoom faces and interfaces. It's a great honor for me to welcome Vincent Timmermann here. First of all, quick introduction on myself. I'm Maike Dohrn from Aachen. I'm a neurologist, and I have the pleasure and honor to work in the CMT field for a while. I'm part of the ECRA board. ECRA is the European CMT Research Association, and Vincent is the newly elected president of ECRA. And if there's anyone here who doesn't know Vincent yet, he's the one who contributed so much to the understanding of genetic causes and pathomechanisms of CMT. Just naming one important gene, which is PP22, but so many others following. So he's really a role model for the CMT research community. So I believe he's really a perfect candidate to represent us as president. And today he gives us the honor to summarize some of the highlights of this conference. And of course, I'm sorry, we might have to disappoint you. We cannot give you all the information on this conference. Sorry, you should have had attended, but we try to give you a glimpse so that you know what we've been discussing, and also that you get an impression what ECRA does and where we are moving towards. So thank you, Vincent, for sharing your valuable time with us, and I hand over to you for your presentation.
Thank you very much, Maike. So let's just see if you can see my slide.
Yes, we can. It's not in the presentation mode yet. Maybe you...
Yet, okay.
This now it is.
Better. Yeah.
Okay. That looks great.
And I will use also a pointer to make it more convenient.
Really great.
Okay. Thank you very much, Maike, for the nice introduction. So this seminar is in frame of the webinar series that we were planning this year, 2025, to prepare and also to get started with the CMT conference and then have some reports. Today I want to give a kind of report of this meeting, and as Maike said, it's impossible to go into detail of all the results that were presented. That's also not the purpose of this presentation, because otherwise, yeah, I need to repeat everything that has been said, which is basically impossible. So the next slide, I'm trying to go down, but that doesn't seem to work. Page down. I need to maybe remove. Okay, now it is. So everything started basically in Paris, where Daniel Tanès, who passed away unfortunately, and Ingolf Pernis asked us to organize a meeting with all the researchers and scientists, so research clinicians and patients, to get together and see how we can process together towards diagnosis and treatment of CMT disease. So this Paris conference was held in 2023, 2 years ago, where we really set some ideas to proceed for the next meeting and also the future of CMT research and contacts between patients and clinicians, etc. So at the end of the conference in Paris, Ingolf Pernis, the president of the European CMT Federation, together with Daniel Tanès, they asked me to make a general conclusion, a perspective of that meeting in Paris. So actually I will do exactly the same now for the second meeting that was held in Antwerp, Belgium, end of October. And at the first European CMT Specialist Conference in Paris, what we aimed there is to actually enforce patients as partners. So really to be closer with our research, with our clinical studies and trials, and to stimulate partnership with the patients, because without patients, of course, we will not be able to proceed with the research, neither with developing clinical studies and trials. So to do that, to have an accent on patient as partners, it was also important to develop a kind of communication system to bridge the distance between the patients and the local physicians and specialized centers. So as you know, with COVID crisis, telemedicine has been installed, and we were thinking maybe telemedicine is also something we can use for CMT in the future. And that fits with health data management within the European health data space, where we can use artificial intelligence in diagnosis and outcome assessment. So we are trying to use artificial intelligence, new tools to increase the communication and also the research in rare diseases. And that can boost the cooperative research by encouraging also the interdisciplinary research teams, but also make connections with industrial partners and organizations active in health policies. So also in Paris, the initiative was thought, let's create a European CMT Research Association, abbreviated as ECRA, as an initiative by the European CMT Federation to implement decisions taken in Paris
I've got
and
a massive echo on it, so I must have
to proceed
more than one
with
thing open.
the future. Maybe somebody can mute his microphone. That makes it easier for me as well. So, and we were trying to join forces of leading CMT researchers covering relevant disciplines and associations and industry. As a joke, I mentioned here that ECRA should not be confused with other associations that carry the same, almost the same name. So the first board of the European CMT Research Association is constituted with Ingolf Pernice as a chair, Filippo Genovese as the president of the European CMT Federation, but also other patient organizations and researchers and clinicians that you see here. Younger people and older people or more experienced people were chosen just to be able to enhance that communication. The first board, the meeting, actually the board was organized always online, and the first time we met was in Antwerp, and here you see the picture taken last month in Antwerp, showing the board members. We also had one guest, which is Professor Michael Schei from the United States, who actually witnessed our board meeting, but also the meeting, and also gave some interesting, constructive comments. So here a nice picture from our first ECRA president, which is Ingolf Pernice, who is also attending this meeting today. So it's really an initiative, the joint initiative of the European CMT Federation, mainly grouping the patient associations and the European Research Association, grouping the researchers, the clinicians and the industry, connecting with and communicating with patients as partners. Here you see a group picture of all the participants at the European CMT Specialist Conference in October in Antwerp. We were about 130 people, and you see a very enthusiastic group of people who attended that on the university campus in Antwerp. And you see a perspective from the sky, and then you have seen that we were all enjoying this meeting. How did we prepare for this conference? First, of course, when you plan such an international conference, you need to invite, of course, the researchers and other stakeholders like industry, but also patient organization, and that takes a lot of time. We also stressed to have an active participation at the conference, including also the pre-conference seminars that were planned online, and some of you have been able to follow these conference meetings. We also found it important to identify the social health challenges for CMT in combination with what is available at the European Health Initiative and research achievements. We also defined, of course, in the preparatory phase of this meeting, which sessions are going to be presented at the meeting. We did a call for abstracts. That means that scientists and clinicians can submit proposals, can even make joint projects, so that to enhance communication between scientists, clinicians, but also really have the patients as partners in this meeting. The conference program has a website. I'm not going to open it, but on the website everything was mentioned so that participants can find their way to Antwerp, and also you can find there the contents of some of the abstracts that were presented there. When you have a conference, you don't only go to the conference, but you also have to think about a follow-up phase. That means that the results of the achievements of the conference should be presented to the public and health policy forums, which actually I'm doing quite right now with this presentation. Also later on we will possibly report the conference in a paper, in a publication, but we will also have videos that will be put on websites of selected talks and interviews, and that will be performed by ComSanté, who did a very nice job to collect all that information. And we hope to create also soon a website where that information will be available. So the aims of the European CMT Specialist Conference is that we should have a conference that is not for profit. It should be European-wide to bring patients together, but also scientists, clinicians, industry and policymakers from all over Europe, so that we have a kind of a community where we can agree upon some aspects related to CMT research. So participants were from all member states, and we also follow there the European healthcare regulations. Also confidentiality regulations were all respected when we present data, of course. And the results should be available throughout the conference and also in the conclusion through the reports, streaming, providing materials and online participation. The meeting that we aimed was also to improve care and accelerate biomedical research for rare inherited neuromuscular diseases within the European health space. And therefore ECRA also made contacts with ERDERA, which is another organization, which is European Rare Disease Research Association, where we can connect rare type of CMTs or CMT in general with other rare diseases to put it on the agenda of the European health policies to give it kind of priority. So that was also our plan. And therefore, we actually applied to the European Commission to get funding to organize this meeting. In addition, we also obtained funding from industry and other more local sponsors, because a meeting is quite expensive and you need to find money to organize such a meeting. So having a meeting together allows you to have a European-wide strategic coordination and to dedicate scientific data, but also medical data and patient data together, so that we can move forward and hopefully find solutions towards therapy development, diagnostic development, etc. for CMT. So the European project contains 5 objectives and a number of tasks, and I only indicate here in bold what is relevant as keywords. So the first objective was to increase awareness of CMT, and awareness can be done by involving education. So how can we train clinicians, physiotherapists, etc., to understand what CMT actually means for a patient? So that's the first objective. The second objective is to create guidelines for care in a strategic way and tailored towards CMT, so that we can actually also consider even digital care, so involving telemedicine and AI measures, so that we can increase guidelines and reinforce them also the guidelines. And that goes automatically to the next objective, is to engage ourselves as researchers, clinicians, but also as patients, as partners with pharma industry, because pharma industry is quite important when you want to continue with clinical studies, that because they will be able to fund the clinical studies, the clinical trials, and therefore also this awareness is important to stimulate pharma industry to move forward. The fourth objective is actually to develop frameworks and agreements to facilitate sharing data between patients, clinicians, and researchers, with also pharma industry in a meaningful and an honestful and a confidential manner to provide healthcare, but also diagnostics to patients. The fifth objective is, of course, coming back, is to really become partners. So patients should also become partners to future research, because without the patients, we cannot proceed to clinical trials, for instance. And that's actually an important goal. So patients as partners can be illustrated by, here you see, making contacts with patient organizations from different European countries all across Europe, even with United States and other continents. So we do not only limit to Europe, but we can shake hands with the colleagues in the United States, in Australia, in Africa, in Asia, all over the world. That's the idea, to increase the partnership. And that can be done by enjoying also ourselves at the Congress dinners, for instance, where we can have a lot of networking. Here you see very nicely how patients actually communicate. So patients share the same medical health problems, and by talking together, I think we can move forward and we can become better partners in trying to find a cure for CMT. Here you see some impression pictures during the meeting. You see people were listening and not hearing. And listening is more important than just hearing. Listening means communication, asking questions, and try to network and find solutions to key problems in CMT research, clinical aspects, and networking. So one example that I would like to mention, and Maike Dohrn will explain you some research examples after my presentation here. So Professor Kleopas from Cyprus gave us a very nice outline on the therapeutic development for CMT neuropathy. So he gave a very nice overview. And that overview showed us that it's a very challenging approach that we are following, because targeting the nerve is a difficult tissue, because we need to penetrate the nerve to reach actually a good and long-term therapy. Also, a pharmaceutical company presented one of the first possible trials for CMT, which is a SOAR trial, particularly for a very common recessive type of CMT. And several patients are already involved in that SOAR trial, and possibly in the future we may have to enlarge these trials. So this is the first trial to be developed, but later on maybe we need a second trial and maybe a third trial, and therefore we need patients as partners, otherwise we cannot move forward. And that will come by different calls through the European CMT Federation or other sources where we can communicate. Other presentations and posters were dealing with therapeutic approaches, but also diagnostics were, of course, presented. There were discussions about physiotherapy, not only involving adults, but also children. We were discussing digital care possibilities. We were discussing genetic and clinical diagnosis by offering gene panels and long-range sequencing technologies to be able to cover more genes, more mutations than in the past. We also discussed the possibility to develop biomarkers of disease, which is very important to make a prognostic, a diagnosis towards disease. How can a disease ameliorate when it's treated? So we need these biomarkers. These can be molecular biomarkers or biomarkers through molecular imaging or magnetic resonance imaging approaches or other approaches, whatever, so that we can have a good, reliable diagnosis and predictive diagnosis and progressive diagnosis of a disease before and maybe after treatment as well. Then another aspect is that what is new in the field is that more and more stem cells can be used to develop culture systems where we can replace animal models so that we can have a prior therapeutic testing of candidate molecules before going into clinical trials. So that's an additional tool that has come up in the recent years. So the search for clinical trials, which is also important in case of the European medicinal agencies, is that we have to follow some guidelines that are coordinated by country, but also by the European Union. So we have to be able to communicate with our patients to provide good guidelines and understandable in different languages. And that's something that will be also challenging for the future, but that's something that we need to consider in the future. So these aspects were all discussed at the meeting in Antwerp. After the conference, the best presentations were honored by providing a prize, a poster prize and a presentation prize to the 3 best poster presentations and the 3 best oral presentations. They were selected by the participants who thought these people, and you see all young people, got prizes. And the prizes were given the name Daniel Tanès Prize in honor of the former president of the European CMT Federation. Our sponsors at the conference were, first of all, the European project that was coordinated by Ingolf Pernis, and I was a co-partner in that project to allow a major financing support of the conference. We also obtained locally some money from Flanders in Belgium, from Germany through the Deutsche Gesellschaft von Muskelkranken, from the AFM in France, Teleton, and also from pharma industry are listed here. So we really thank all these industrial but also institutional and patient organizations and the European Commission for helping us to make that meeting possible. The new board was also elected in Antwerp, and here you see the new board. So we had the first board to create the CMT meeting in Antwerp, and we also elected a new board, and I will be the new chair after Ingolf, and you see that Ingolf is here looking from the backside now to us, meaning that he will definitely also watch that we do our job, and he will tell me if we don't do our job good enough. I can count on Ingolf for that. But you see, we have agreed upon even enlarging the board a bit more than before, and involving a good mix of more senior people and also many junior people, so that we can transfer the knowledge and we can show that there is a kind of enthusiasm in continuing the partnership between patients, clinicians and industry to move forward with CMT diagnostics and therapies. So the impact of the European CMT Research Association can be divided in 3 parts: the short-term objectives, mid-term objectives and long-term objectives. So the short-term is quite easy. So it's to do awareness, engagement and find opportunities. So I listed that with these 3 cartoons, which make it clear. The mid-term is to search for joint and make new initiative, new projects. And already at the CMT conference in Antwerp, we have started new initiatives already by networking during the Congress dinner, etc., and during the poster sessions. We also plan to create prototypes for digital care to provide information and telemedicine, and also start thinking about to develop European and global patient registry to be prepared for clinical trials. On the longer term, we want to improve that communication. So communication is not only short term and mid-term, but also on the longer term, we need to continue communication. And that demands a lot of energy from everyone to continue to improve and to communicate and take care of the digital care as well. And to continue with registration of patients, allowing increasing databases so that we can have access to important information for researchers, but also later on for pharma industry to allow clinical trials. So diagnosis and outcome measures can be enhanced through novel tools of artificial intelligence that is applied now in all kinds of fields. Everywhere, everyone is using AI nowadays, so I think it will also enter the CMT clinical and the research aspects. And the idea is to find cures not only for one, but hopefully also more types of CMT. Communication dissemination is important, and also visibility towards what we want to achieve. That means that we need to spread announcements through our website. We want to write reviews and reports that are relevant for the research and the medical aspects. Social media will be reinforced through the European CMT Federation, and we also aim to increase access by offering different possibilities to have access to the website in different languages. So by country, we'll probably have to contact people who can also take care of translation of some important information for our patients. We will continue in processing reports of relevant congresses, not only congresses that we organize like the one in Paris and in Antwerp, but also at the Peripheral Nerve Society annual meetings, where we have the CMT and related disease meetings or sessions where we can collect information and also spread through this European CMT Research Association website. We also would like to partner with the European Neuromuscular Center to organize specific workshops on CMT so that in smaller groups, people can come together, discuss about science, clinical aspects, diagnosis, trials, etc. Because in smaller communities of about 20-25 people with experts all over the world, we can really make guidelines, criteria that can assure success of clinical trials, success of diagnosis, success of communication, success of treatment, etc., etc. I'm trying to go down. The computer seems to block. Okay. Then we have to be sustainable and to continue. So that means that there will be a follow-up after the conference. So there will be a future strategy to develop. And since I will be the new ECRA president, I will have to take care that we have a future strategy. And that means that we will have to consider a few European regulations like everyone is obliged to do. So we have to respect some ethical aspects, which is quite important. We also need to engage in dialogue with patient organizations of other rare diseases so that we can have an idea and gain experience from other associations so that we can have a broader scope that can be implemented also for CMT as a separate group of rare diseases. And translate proposals, of course, to other rare diseases So also take our responsibility to maybe inform other groups or rare disease cases, so that we can have a common action for the benefit for all the interested groups. We need to collect ideas and priorities to make an action plan for the future and define clear deadlines so that we can proceed and get what we want to do. Therefore, we want to make a draft action plan based on the board members of the new ECRA. And we will hopefully meet somewhere end of this year. I still need to fix the agenda, but we just completed the meeting in Antwerp, so there's a lot ongoing now. So, and then also probably by beginning of January, we have to make a report also to European Health Program for which we received funding. So we have to deliver some results in a written document that we have to provide to the European Commission. So one of the tasks of the European CMT Research Association will be to provide also young researchers and clinicians a mentoring and support to set up joint projects and grant application. So that's very important that experienced scientists and clinicians with other health professions as well as patient organizations can be committed to inform also younger researchers, younger clinicians, where appropriate, to learn how we can move forward, and also they can, as young scientists, young clinicians, can also learn the more experienced scientists to create new ideas. It's only with young people that you create new ideas, new initiatives, and the more senior people can help them to facilitate that. So that's also one of the tasks of the European CMT Research Association. When possible, so ECRA will also serve as a funding support, and that's a very challenging idea. But thanks to some patient organizations who already are able to collect funding to support projects, I think we will be able through ECRA to add to that so that we can even find more support for these associations so that more projects can be funded in the future. So that's also a very important task of ECRA. How can we do that? Awareness campaigns is something that definitely will be continued and mainly has to be performed by the European CMT Federation. So because awareness occurs through the European CMT Federation, because it will be also possible to have access in different languages in each country so that we can reach the patients, but also clinicians in all the countries in Europe so that they know what is CMT, how can communication be achieved between the patient, clinicians, and maybe also the researchers and the industry. So the conclusion of our conference in Antwerp was much more than just a 3-day meeting. It was basically a strategic investment in building a resilient, collaborative, and patient-focused research ecosystem for significant care disease in Europe. The European funding that we obtained was basically instrumental in achieving all the objectives that we stated, to execute a successful digital engagement campaign, to launch a permanent research association in the European CMT Research Association itself. We were able to share knowledge, to reinforce partnership, establish new partnership as well, and create infrastructure that allows us to have an impact on the CMT community for the years to come. And that's basically, so we want to have again a problem with my slides. So that's something that we definitely want to continue. And now I would like to give the word to, so I'm going to stop a presentation. And I would like to give the word to Maike, who also prepared one slide. And after that, I would like to show you a movie, give you the impression on how we actually met in Antwerp, because I think it's important to show you an impression of a conference, an international conference, where you will see people communicating with a very friendly atmosphere and with happy faces. Thank you very much. So Maike, it's now your turn.
Thank you, Vincent. I would love to just give a minute to you to enjoy your applause that you really deserve, not just for this presentation, but especially for even like being the creator of this amazing conference. And I really have to agree with you that it was very special, the atmosphere, how people communicated, and everywhere when you left the sessions, you came out, you always saw people chatting and discussing, and very vivid poster sessions, very communicative breaks. So I really enjoyed that. And that was definitely facilitated by the whole atmosphere that we had in Antwerp, and also by the respectful and open-minded and inclusive invitation that you and also Ingolf made happen. So I think before I share my one slide, we have a few comments in the chat. One, I think...
Just check me as well.
Yeah.
Because
so I think
now I can read them. Yeah.
Important comment is by Filippo, who suggests to also to keep updated, follow ECMTF on social media and check the CMT Awareness.com website. I think that's crucial because I saw a lot of posts from ECMTF on the conference, and I think those posts really captured the atmosphere that is hard to describe now in an online call. And I have a question actually that really addresses this. I think that also goes along with the questions in the chat. Vincent, we had so many preparatory meetings online, and now we have a webinar online, and there's so much happening online since 2020. But this conference was in person, and that was like everyone was there for real. Critically asking, why do you think, like, is it necessary to do all this effort, to have everyone coming, to get all the money? Is that like, is it worth it? And why? Like, why was it so important?
It is very important to meet also face to face.
Yeah.
And the reason is online, you can never make these intense contacts between people. So you need to have a conference dinner. You need to have a poster session where you can discuss openly without being felt a threat by a camera. By some, a camera is something frightening to people. And why, if you don't have this, you can freely speak. You can give your idea. You can give your critique also. A critique is very important. You can give a positive critique, and that is very constructive. And that is the only thing that you can do at a conference where you don't have too many people.
Yes.
Because if you organize conferences where you have more than 1,000 people, then also that dilutes. So that's why I'm very favorite of having a conference with about, like we had the size now, 130 people. And even if you organize workshops like with the European Neuromuscular Center, where we have less people, it's even more intense, because then you can really discuss openly. You can find the problems that there are, the challenges for the future, and that's something that you cannot do online. Online is mainly briefly. You can inform each other, but you cannot take steps. Basically, you cannot make major steps towards collaboration. It's more informal. It remains informal.
Yeah, of course, this was a very rhetorical question. So I 100% agree with you that
it's not possible to replace such a meeting by online meetings. And this is why also, sorry again to everyone, this webinar will not be able to capture everything that has happened in Antwerp. So like as a very good match to this conclusion, there is a question in the chat, where is the next conference and when? Do we already know?
No, we don't know. Actually, that's why we have created the second ECRA board, so to discuss the next step. There are already some ideas. So we already in Antwerp, we had already some ideas. I'm not going to reveal them because I'm not sure if that will happen. But the money is also an important issue. So again, we will have to find sponsoring to organize the next meeting. We cannot do that every year. We have to be realistic. Every year is not possible. It's too expensive to do that. It's too challenging as well. And we also don't want to repeat what has been done the year before. So that's why we probably will have to do it in 2 years. And 2 years is a reasonable time, because then you can prepare, you can discuss, and come with new things. We can really show more advanced progress at different scale. Diagnostics, therapeutics, trials maybe already starting, and to continue, new initiative. So we need a bit of time to prepare the next conference. That's logic.
So to everyone who is interested in attending more conferences, I think we all can really warm-heartedly recommend the PNS meeting, Peripheral Nerve Society meeting. It's a very scientific meeting. It's different from what we just experienced in Antwerp. However, I think it's a very good add-on, right? So scientifically, it informs a lot. But I think what we managed very well, especially you, Vincent, but everyone in the task force, is to not make the Antwerp meeting an echo of the PNS meeting. And it was also the intention to have it like, even though the community has some overlap, of course, I think it's really important to have it a bit different. So I think those meetings are very well complementary. And if somebody wants to attend meetings every year, please go to the PNS meetings. And then maybe in the future, every other year, I hope so. I would love to. Let's see how we can organize. We might have ECRA meetings then in person. And I think I'm sure, like I can say for now that we will keep you posted online, all of us. And then I think before, another comment I just see in the chat is that somebody said it would be really helpful to actually translate content to other languages, for instance, Spanish, because we have many people from Spain and Latino countries following. I agree, let's do that. I think this is a really good plan for us to do, because also we represent many countries, so it shouldn't be too much of an effort that everyone helps to make our content available to our local communities. Good.
Yeah, and maybe to that, if people are volunteer to do translations, please contact Filippo Genovese, because he will be very happy to say where we still need some translation in each country, so that the communication can be realized. That's something that you have to organize with Filippo Genovese. I'm not sure, Filippo, if you want to address something about that, how people can reach you.
Totally. There's always room for lending a hand, and translation might be an issue, but as I commented below in Melinda's comments, once the all the video basically of the conference will be uploaded on YouTube, we will all have the chance to choose for automatic translation of subtitles. So this could be an easy option to get the general meaning of the discussions, at least.
Yeah.
Very good that you're mentioning the YouTube channel. I think that is a very good source to recapitulate what has been discussed, and there are many, many clips and videos, and some people in the organizing team have put a lot of effort in the fact to make everything transparent and to capture whatever is can be drawn out of this conference. So the YouTube channel is definitely something I would recommend too. And then, oh, okay, great. Filippo, you posted the link in the chat, so everyone should be able to see it now. Great, thank you. So before I show my one-slide summary of the conference, I would like to give Ingolf the chance. I think you wanted to also say a few words. Is that right?
Yes, sure.
Yeah.
Yes, and I did prepare a few slides also. And
do we need to introduce you? I don't really believe so. Everybody knows you, but
no,
Ingolf is just amazing. Ingolf is the founding father of ECRA and the former president. So he received a lot of standing ovations at the conference for all the work he put into this. And I think you added two really important perspectives to ECRA. One is, of course, the patient perspective, which we can never leave out of our considerations anymore. And one of the conclusions was that patients no longer should be too patient. So it's really important that ECRA has a strong patient representation. And the other perspective that you added to ECRA is that you are that you are really an expert in law, European law. So with your expertise, we were able to somehow survive in the mass of paragraphs that we needed to go through, and to it was sometimes quite challenging, I think, to understand how to found something so international as ECRA. And your support was like just massive. So thank you so much. And now I stop talking and I let you give your little presentation as well.
Yes, thank you very much. I would like to share some slides also. What I wanted to show you, how lovely, with how much love this conference was prepared by the team of Vincent in Antwerp. Look at just the badge we had. That's on the right side here. Let's step together for CMT and second conference, etc. This nice presentation is much more inviting, more inspiring than normally badges are, because normally badges are just carrying the name of the person, etc. I wanted to show this as an example, how careful and how mindful the preparation of the conference was from the side of Antwerp, of the Antwerp University, and the team of Vincent. So let me give you another point. As you may know, for the evaluation of our conference, we prepared together with Filippo a survey. And first results which I have seen in the survey is this quote, which I would like to read out because it's so important to me. The key differentiator for this conference from other scientific meetings was, as intended.
Should I just share my slide?
Yes,
and then
maybe you can share. Yeah.
Yeah, good. So I kick Ingolf out, unfortunately. Okay, so I share my screen, and then I have my slide ready. Can you see my slide now?
Yes, perfectly.
Good, thank you. So Vincent gave me this this challenge to present the whole conference, especially the scientific content, in one slide, which I think is a really, really difficult task. So I was wondering how to best account for it. And my first thought was like, how do I begin to somehow get into this slide? So while I was thinking and I noticed that my thoughts were spiraling, I'm not a designer, but I figured it's maybe a good symbol, this spiral, to show that everything comes together at some point and that everything needs to flow and that it's not just one moment that can help us, but that everything has to come together. So I decided, well, now it's working. Yeah, I decided to start somewhere at the beginning of the pathophysiology.
I know, Charcot-Marie-Tooth Specialist Meeting in Antwerp.
With gene-disease relationships.
I'm getting invited to a lot of things.
Mute everyone. That would be really great because then, yeah. Okay.
Take care of it.
Thank you. So I think we all have to start somewhere with gene-disease relationships because the genes and the genetic mutations are the beginning of a cascade that eventually leads to a phenotype and are also the target of our disease-modifying treatments. So we heard a lot, very novel knowledge on several genes, which are like DAS2, NAS1, PIGB, SORT, and SORT2P in versions. Also, some trinucleotide expansions, which I think is also really crucial right now, and several other new genes or new gene-disease relationships, which I think was really thrilling to learn about. And then, of course, we needed to talk about models and methods. So how can we best model disease mechanisms? Because we need this to also understand what damages nerves and what helps us or what could be helpful to target those damages. So we learned about iPSC-derived assembloids, which is a very novel model that imitates the natural survival or surroundings of nerve cells, and about a CMT1A mouse model. We learned about pathomechanisms that are really crucial to understand. So what is actually happening in the cells that eventually causes CMT? I just picked some that we talked about, which are like lysosomal dysbalance, nuclear envelopathy, macrophage Schwann cell crosstalk. So quite specific mechanisms that all come together around CMT proteins. And of course, we discussed disease-modifying treatment concepts, and Vincent has already mentioned the amazing talk of Cleopas Cleopa, who gave us an overview on genetic and gene therapies, current state of the art. And it's very difficult to summarize such a talk. The good thing is so much is happening right now in the preclinical and even coming to the clinical stage. So I think it is a really good time to focus on CMT, because a lot will happen in the future. That was at least one of the take-home messages that I had from this meeting. Some examples that we learned from novel research projects was on alpha-1 antitrypsin, on mesenchymal stromal cells, on ADAC6 inhibitors, and also on new deliverable strategies, like how can we get a therapy, a gene, for instance, into the target cells. So that was really interesting. We talked about outcome parameters and biomarkers. And this is important because right now, when we are facing towards clinical trials, we need to be ready for this. We need to be able to measure disease progression and also to measure treatment response. So also already mentioned is AI. AI can help us with many things. Of course, it cannot replace us as researchers, clinicians, and patients, but it can add to the community, I would say. And there was one project presented on differentiating CMT and CIDP. And we learned also about circulating blood biomarkers in CMT1A. And then there was a lot, and I think this is extremely important, on natural history and for the future also European collaborations. So we learned about Dancer, which is a movement analysis tool that helps us to define normal and abnormal movement. We learned about digital care without borders, which I think is also extremely interesting and a good starting point for ECRA to develop. You learned about the map that is intended to inform on where you can get treated. And we heard a lot about networks like ECMTF, which is a patient-led network. We learned about the natural history of CMT1A, and also about the European patient journey, which gives us another option to better understand what patients need and where they are standing, and how we can best integrate whoever wants to contribute to all this spiraling knowledge. We learned about the already functional registry from EAN and UNMD, and about the phenotype spectrum of HSPB1-related neuropathy. So you see that those projects that were presented in Antwerp are very diverse, but all have a common goal. And I think that was a really beautiful thing. Even though some people here focus on genetics, others focus on AI technologies, others work with mouse models, and some work directly with patients, some are patients. I think it's really cool to see how this all comes together in this spiral. So this was my one slide. I stopped sharing here. I hope Ingolf is back. Yes, he is. I can see him. And if there are, I don't see any urgent questions in the chat. So I would like to hand over to Ingolf again. Let's try again to see your perspective.
I'm back. Yes.
Awesome.
It is frozen suddenly and everything break down. And so I came back. I had to close and come back. Sorry for this incident. Should I try or should I not try to again?
Sure, yeah, please
share?
Try again.
I just
we don't get
put
easily
on share.
discouraged.
Can you see something now?
Yes, we see your screen.
Yes.
The screen? Yes.
Yeah.
Yes.
And now I will try to share the screen
Yes, I think one to the left should be
one to the
probably.
left. Here,
You
this
can
one.
yeah, you can press that one. I think that should work.
Does it?
Yes.
Yes,
Yeah,
now
that's
it works.
perfect.
Thank you.
Perfect.
Oh, so sorry for that. I will be quick. So this is this wonderful batch, which I wanted to mention to show how nicely and with much love was prepared this conference. And then this text, which I found so important from the survey, which we tried to continue to set up, and the first reaction in the survey. One was this, to explain what is the difference between the other scientific meetings and conferences, congresses, and our Antwerp conference. And they say the key differentiator for this conference from other scientific meetings was, as intended, the unique format of bringing together all stakeholders, not just scientific and clinical, in the field of CMT, including physical therapists, patients, advocacy groups, companies, and political leaders, and the emphasis on fostering small group discussion and strategic coordination. Strategic coordination, this is one of the big practical ambitions we had. The comparatively smaller size of the conference was really an asset, as were the abundant opportunities to mingle and network, i.e. longer breaks in between stimulating talks. Together, these features delivered major value for all participants, and I hope it will be continued. So that's what I hope too. Let me give you 5 slides or 5 ideas for this conference from the patients. The first is the paradigm change, which is patient as partners. Second is together we are stronger, ECRA. The third is what do we patients need? The fourth is outcomes of the conference, what was good for the patients, and then the way ahead, my hopes for the next years. So I stole the picture of Vincent, which is so wonderful. because it shows so many things. And what does this picture really mean? In my view, partnership counts. It shows solidarity. Let's stick together and step together. Let's look ahead, and go ahead together. This is all what I can tell you, what we have seen in Antwerp. So let's see just a picture from our ECRA. And perhaps in talking about ECRA, from the patient's point of view, my most important experience of the whole process from the first conference in Paris to the second in Antwerp. Now, the most important message I got is incredibly, patients can do something. Patients are not just objects, but can make a difference. And this is thanks to the openness of the researchers and all the others which have participated in Antwerp. So researchers and clinicians and other health professionals and even the industry. So ECRA has an executive board, which is the president and the vice president. And what is important, it was decided that we will have a vice president, a second vice president, who is there ex officio. That's the president of ECMTF. This is the patients' organizations at the European level. And then there's a secretary, treasurer, and 5 to 7 other members elected. What do? They implement ECRA tasks, they coordinate it, and have this strategic planning, make proposals for the annual plan and budget. And then there is the General Assembly. So I do not go into that too much, but just to show how we think now we can organize structured cooperation between the patients and the professionals and researchers. And what is, of course, very, very important, Vincent, to congratulate you to be the first elected president of ECRA. All my best wishes to you. Now, what do we want? What happened now? Oh, somebody clicks the hands. And yeah, what do we want? What did we get? We want awareness. Patients, be aware of the fact that many patients do not know that they are patients, that they are affected by the disease CMT, because there's an average time until you get your diagnosis of 10 years, and that's too much. And that's what we want and what we get. We got now webinars, live stream videos, and all the action in the social media. So Antwerp helped so much to raise awareness on CMT. What we want second is empathy. Listen to your clients with respect. That's addressed to the researchers and to the clinicians. So what have we seen? Yes, patients' initiative was appreciated. Patients could talk at the stage. So we were very happy that we were invited to and given the opportunity to express what we really need. Education, to understand what you're doing as researchers. We need education. And what is CMT? And what can I do for myself? So we had the introduction in the opening session. We had Cleopa, the introduction on the overview on the therapeutic approaches, etc. And then we had a very interesting introduction on physiotherapy, what can already be done even if there is no express cure.
Ingo,
and what we need. Yeah,
you're not screen sharing anymore. Would you like to share presentation again with us? Yeah, because some people were very attentive in the chat and commented.
Can you see anything, or is it not?
No, the screen sharing seemed to have stopped. Very sorry to interrupt you again.
That's interesting.
Somehow stopped.
I'm not happy with this.
No, it's maybe the tool, but let's want to try again.
I'll try again, yes. What about now?
Not now, not yet.
No. I stopped the screen sharing. Where can I stop this? August, I don't, this, okay. Can you see it now?
Yes. Thank you.
So I go through, we are here. Have you seen this?
Yes, that
And
was
we're
the last
here
one
now.
we saw. Yeah.
Yeah, okay. So
Very good. Thank you.
we had the plenaries. Information is so important. Plenaries on basics, on the diagnostics, on the therapies. So we had a lot of information, which of course we understand better if there is a good plan for education to learn really what CMT means. So all this has been started in Antwerp, and we will go into that much more deeply. We need access to the specialists and to professional care. And Vincent already talked a lot about digital care. And what is important is that if we have CMT, we are not so mobile as other people. And then go to the doctor, go to the specialized centers is sometimes very, very burdensome. So bridging the geographical gap, just bridging the gap between the patient and the specialist by digital means could become a very important thing for the patients. And then participation, what you did already, open-minded as you are, the researchers and clinicians, participation to be included in the ECRA programming and work, and so contributing to make progress possible. This is one thing which we would like to do in the future. The outcomes, again, concept of the patient. Oh, that by the way, it was a wonderful idea of Maike Dohrn, our coordinator here in the meeting. Maike said we should reconsider, revise the idea of patient. Is that adequate or is it not? And she said to me afterwards in a little talk that in German, Betroffene, which means affected people, the affected, it's not a really good expression in English yet, but that's what we mean really. It's better than to talk about patients. Patients suffer, yes, they are subordinated, yes, true, but they also want to be included. So the concept of patients is so important. Is it still, my screen has changed now for this moment?
You stopped sharing again. I don't know how that happened.
It stopped sharing again.
Yeah.
Okay.
We see you, which is nice, but I assume you prefer to share
Is
your
it shared
side.
now?
No.
Or is it still not shared?
Still not.
What the hell is happening
kicks you
here?
out.
Okay, I'm sharing again.
Yes,
Can
now
you
we
see
can see
it?
it again. Yes.
Yeah, really? Full screen? So I go
Now it's
down.
full screen again. Thank you. Perfect.
So what we need then, training programs, which is one of the deliverables of this conference for medical schools, and an online seminar on CMT. That's where we can learn. Then we have a joint project now on the process, which is aiming to facilitate patient access to specialists and treatment. Then we have data also in preparation, a data sharing framework for health data and management. So to ensure free access for the researchers to the data they need. You know about the European health data space, which is a sort of legislative framework now for what we intend to reach now is the access of researchers to the data. And then the Model Joint Research Project, which is including an industrial partner. so to ensure that there is enough funding. That's another sort of way to ensure that funding is available for the research in CMT with the laboratories, etc. Everybody knows that better than me, is extremely expensive, so needs funding. So we are happy to have these results, and we will have to work out the papers on that, on the different deliverables. Now let me say, what is my dream? Where will we stand in 10 years from now? So my idea is that there will be the 7th European CMT Specialists Conference in Rome, 2035. So each year every 2 years one conference. Then ECRA exceeds the 500 members, and Vincent will be the president of honor because after 10 years he might be tired to continue to be the acting president. Then genetic diagnosis available. Oh, is an A missing. For all forms of CMT known so far. That's very ambitious. Cure on the market for more than 50% of all genetically diagnosed CMT patients. Then CMT patients advocacy groups globally associated because CMT does not know borders. We should work on CMT globally. And a global federation of CMT research associations. So ECRA goes global within 10 years. That's what I would like to dream of. Thank you very much indeed. And I close now the presentation. And is it closed? Do you see me now?
Not yet.
Finished.
Now it's closed, yes.
Thank you very much for your patience, and including for the technical difficulties, which I cannot explain. I'm sorry.
Great. Thank you so much.
Okay.
Thank you to the speakers. Thank you, Vincent, for making this happen. All this, not just the present webinar. Thank you for all the people who listened until now. Thank you for the advice to collect the presentations beforehand next time. I will do that if I get another chance to moderate. Thank you for the ones who asked questions, and thank you for the ones who contributed. I'm very happy to be part of all this, and I hope that you all join us on YouTube and for the next meeting, of course. We will announce. Keep you posted. Thank you very much, and wishing you all a nice evening.
Thank you so much. Bye-bye.
Bye-bye.
Bye.
Thank you.